I'm Dr. Pavan Kumar, Surgical Gastroenterologist and Colorectal Surgeon from Yashoda Hospitals. Question which patients usually ask us is, Doctor, does all fistulas need surgery and is it completely curable? Patients usually come to us whenever we say patient has fistula disease, they mainly have two big doubts. The first doubt is patients losing control for the motion. This is what we call as incontinence. This first problem happens not because of the treatment given to the patient, but because who is giving the treatment. Suppose fistula is a common condition. Many of the times patients approach a local quack or local native practitioners for a surgery, and these patients who are not properly trained to do the fistula, if they damage the surrounding muscles, this is a problem which can arise. But it's not because of the treatment of the fistula, but because the surgery is not performed properly. So when a patient comes to as a experienced and a well-trained doctor, incontinence is not at all a problem. Continence, the control of the stool following fistula surgery is 100% assured in this, especially with the development of lasers where we do not damage the muscles itself. So second question which patients ask is, Doctor, is fistula definitely curable with the surgery? No one in the world can give a 100% cure rate for fistula, the first surgery itself. But it doesn't mean that fistula is not curable. When we approach a patient with fistula, no two patients are same. Depending on the type of the fistula, we need to customize the treatment based on the patient's condition and because they based on the fistula condition. So with the advances in the laser management, lasers, and with the advances in the imaging, the effectiveness of the surgery is quite high and the recovery from the surgery is quite fast. So most of the patients usually have a 90 to 95% cure rate in the first surgery itself. The rest of the 5 to 10% of the patients may need a second procedure, but very rarely patients need a third procedure. So it's not, this fistula condition is not like a diabetes or a hypertension which doesn't have a cure which they have to live throughout the life. Fistula is completely curable. Only thing is, no one can assure a 100% cure rate in the first surgery itself. The first surgery gives 90 to 95% cure rate in experienced hands with the latest techniques in treatment of the fistula. Perineal fistula is a common condition. There are a lot of advances in the fistula management, like advances in the imaging, like MR fistulogram, and advances in the laser for proper planning of the surgery and execution of the surgery. So these techniques improve the outcomes in the patients, in that patients do not have to worry about the incontinence, the lack of control for motion that is no longer exists with laser treatment. The effectiveness of the surgery, the chance of recurrence is less than 5% in patients if you're properly doing with the laser surgery and proper planning of the surgery. The third is recovery. Patients usually are worried that because fistula surgery is an open surgery, it takes 2 to 3 weeks out of their work. They have to be bedridden for the course of 3 to 4 weeks for the healing. But with the advances in the laser surgery, minimal access surgery, recovery from surgery is quite fast in these patients. Most of the patients can return back to work within 1 to 2 weeks following laser surgery for the fistula. So this makes the surgery quite effective, fast, and safe. Thank you.
Like, comment, and subscribe for more health updates.